Sorry, Governor. Sorry for the technical difficulties. Good afternoon, everyone. I will start with numbers, and then we'll talk a little bit about some medical care needs. So since yesterday, over the last 24 hours, we are reporting 2,294 new individuals with COVID-19. We now have a total of 96,485 confirmed cases throughout the state of Illinois, and that encompasses 100 of our 102 counties. We also, unfortunately, are reporting over the last 24 hours 59 additional fatalities, which brings our total fatality number to 4,234. Over the last 24 hours, we resulted 21,297 specimens. And as of last night, regarding hospital statistics, we had 4,120 individuals in the hospitals with a COVID-19 diagnosis, and of those, roughly a quarter, or 1,096, were in the IC, were in the intensive care unit, and 636 of those in the intensive care unit were on ventilators. So as we continue to forge ahead in our life with COVID-19, there are things that we're going to start getting back to. And this includes, of course, taking care of our health, all parts of our health. While we're aggressively trying to prevent getting COVID and standing down if we do contract it, we also have other medical issues that we do need to attend to. I know there may be some fear about being exposed when we try to seek medical care for other issues, but we do need to prioritize our well care visits, whether it's our children's well care visits, whether it's going for a screening mammogram or other important screening or diagnostic tests. We have to remember that these health visits are important and they are essential, if you will, and they can't be put off indefinitely. And we know that COVID is not going anywhere anytime soon, so we need to make sure we prioritize these important medical procedures and events. So I urge you to talk to your healthcare provider and learn about what your provider's office is doing to protect the patients as they're coming into the facilities. They can let you know all the steps that they have taken to help you stay safe, to help keep their staff safe during your visit. Again, with the time that has elapsed since the beginning of our relationship with COVID to now, we now have a lot of information that has translated into important mitigation steps and additional steps to keep us safe as we try to take care of our health and visit our medical providers. If you have specific questions or concerns, call your healthcare provider. Learn what they're doing and get the medical care that you need. It's also important that you monitor yourself for potential new health threats. So we know all about coronavirus. We've been talking about that here every day, but let's not forget some of the other viruses that continue to be with us as well. We'll be talking very soon about influenza and how we're going to protect ourselves against that. But let's not forget the HIV. The human immunodeficiency virus is another illness that can mirror COVID-19 symptoms. So we are reminded about the importance of continuing to routinely screen for HIV and to be vigilant about distinguishing COVID-19 from HIV, which may have similar symptoms. In an HIV Illinois Getting to Zero Implementation Council meeting that occurred last month, an infectious disease physician from the University of Chicago Medicine discussed that they are still routinely screening for HIV as they respond to COVID-19 in their emergency department. In fact, they diagnosed 2 individuals with acute HIV. When people are seroconverting from HIV negative to HIV positive, the symptoms they exhibit are often flu-like symptoms, which obviously mirrors what we're seeing in COVID-19 patients. So please don't ignore your symptoms and don't be prevented from getting the care that you need. We do need to take care of ourselves, our whole selves, including all of our physical health. We need to take care of our body, mind, and spirit. So let's do the things that we need, whether it's having a visit with our social worker or our psychologist, or a well child check for our child with the pediatric provider, or getting our screening and diagnostic studies, let's take care of ourselves while being as safe as possible, while wearing masks when we're outside, while maintaining social distancing, while frequently washing our hands and cleaning frequently touched surfaces. We can do all these things together. Let's remain all in for Illinois.